Hi, good morning. This is Dr. Chandramouli. I'm a consultant surgeon working at SPARSH Hospital, Bangalore. Let's talk about bleeding from the intestinal tract. When I say intestinal tract, it can be bleeding from the top end or bleeding from the bottom end. Bleeding from the top end means anything which happens in our food pipe, in the stomach, and in the first part of the intestine. How do these symptoms present? If there is a history of severe heartburn, abdominal pain, and the patient starts to retch or starts to vomit violently, and along with that, he brings out blood in the vomit. This we call it as hematemesis, meaning bleeding from the upper gastrointestinal tract. The common causes we come across in our daily practice is, as you're aware, gastric ulcers. So, who are the potential patients who tend to bleed? Patients who are on blood thinners like aspirin, clopidogrel, patients who have liver disease, patients who have a history of gastric ulcer or a duodenal ulcer. They are the ones who are prone to develop bleeding due to erosion, or the surface, the mucosa of the lining gets eroded. So, you have to get a good history, and most important thing is the volume of blood. In case of a condition called esophageal varices, which we normally see in patients who have chronic liver problems, who develop thickened blood vessels in the lower part of the food pipe, tend to bleed very dramatically. And this can be very life-threatening and has to be addressed on a serious emergency basis. If we don't get him to the hospital in time, give them the right kind of treatment, transfusion, resuscitation, the patient can have a very bad outcome. Coming to the bleeding from the bottom end, or anal bleeding, or rectal bleeding we call it, they're commonly due to hemorrhoids, or what we call piles. There, the bleeding is of short duration, it is bright red in color, and usually it is painless. If it goes on for a long time and the blood is mixed with motions, then we have to start worrying. This could be due to anything ranging from an inflammatory bowel disease to cancer of the large intestine or the rectum. So, pain while passing motions, motions mixed with blood and mucus for a long duration, incomplete evacuation. Patients complain of passing motion and again go back and sit in the toilet to pass some more after some time, indicates that there is something blocking the bowels. So it's basically a common sense approach to the whole problem, and it's imperative that you seek medical advice, and a simple colonoscopy will diagnose the problem. Thank you.